Yeah, this is definitely unique.
What looks like just another new medical building in Greensboro is really a revolution.
The days of staying in a hospital 4 and 5 days for an operation aren't necessary.
So, which leg is cracked?
Right.
Right leg.
Because someone who needs a new knee, for example, isn't sick. They don't need to be in the hospital. So doctors like Steve Lucy can do joint replacement in their new outpatient facility where you're far less likely to catch something since you're not around sick people. But the truly revolutionary part of this place is how the care is paid for.
And so what we're seeing in environments like this is that the physicians are taking control of how to best manage the care.
The way this has worked for years is if you have a procedure like a knee replacement, the insurance company or the government, if you're on Medicaid or Medicare, talks to everyone independently. So it'd be the insurance company that would pay the hospital for the use of the operating room, would pay the surgeon, or maybe it was the government who would end up paying the anesthesiologist or the physical therapist. And it all worked off sort of a blind protocol because neither the insurance company nor the government knew the patient personally. So Dr. Lucy and his team started to do what everyone thought the Affordable Care Act was designed to do. They reinvented the process by getting the insurance companies to pay them one flat fee, and they then managed the patient's care. A seismic shift in the industry.
It's like two rivals coming together and playing on the same team. It took 8 meetings with Blue Cross to get to yes, 8. The early meetings were not pretty, and then by about meeting number 4, we really began to realize we could help each other.
And the patient, by doing the same procedure in an outpatient facility for about $25,000 instead of the $40,000 it currently costs in most hospitals.
You're talking a good 30% higher than an outpatient setting.
It seems like a big win for everyone. Better outcomes at a much lower cost. Hospitals, though, say there is a hidden cost, that they will have a hard time treating patients that they lose money on if they don't have the profit from doing these more lucrative procedures.
The opportunity exists for other folks, I call them entrepreneurial healthcare providers, to choose the services they wish to provide from 8 to 5 or 7 to 5, Monday through Friday, and then health systems still have to be the safety net for the community and yet can't continue to offer the services that help offset those costs.
But the doctors at the surgical center say this is a pattern hospitals have survived before.
Where you can see the evolution of all kinds of care that have started in a hospital and then been made to be more safe and then brought to an outpatient environment for the cost of it.
And it appears there will be plenty of work to go around.
The forecast for total joint replacement is incredible. There's about 1.4 million that will be done in this calendar year, 2017. By 2030, 4 million. So there's enough joint replacements to be done in inpatient and outpatient. We will fill up the operating rooms with them.
And won't empty your pockets in the process. Bob Buckley, Fox 8 News.